Mike Holmes begged a 911 operator for a crisis intervention officer last night.
I don't want it to be another incident where somebody's not trained and they come in to get out of hand.
She understood the risk of calling for help, but there are communities that have mental health professionals inside 911 call centers waiting for these calls.
Some of the really bad outcomes that we've seen for law enforcement uses of force in the community started with a mangled 911 call.
Tonight, investigative reporter Rebecca Lindstrom takes us inside Tucson's Crisis Response Center to show us how their system could make a difference for any community in crisis.
Tucson's system can be really summed up in 3 words: no wrong door. From the crisis professional waiting at 911 to take your call to police. In Tucson, about half of its officers are trained in crisis intervention.
Hi, sorry to bother you. My name's Officer Godfrey.
And the city has created special teams to focus on crisis prevention.
It looks like he's been trying to get her treatment, and she says she doesn't need help.
I followed one team as they traversed Tucson, transporting one woman for a mental health evaluation after allegedly failing to follow her court-ordered treatment plan.
You know, there's a lot of talk around the country about parity, right?
And that conversation usually focuses on health care. But Sergeant Winsky believes it should relate to police as well.
If you look at a police department that has a DUI squad or a gang squad or any other specialty squad, why wouldn't you have this one?
He says due to their specialized training, in 8 years, only once has his team had to use force, and they've arrested fewer than 10 people. That's because when someone is in crisis, they can bring them here.
So this is our urgent care area.
Margie Balfour helps run the Crisis Response Center, or CRC.
We don't use any security staff. We take highly agitated people. Those are the people who most need a specialized facility like this.
Police say the CRC is the heart of why they can do what they do. It can take hours for an officer to drop someone off at the ER for an evaluation. But here, it takes less than 10 minutes. That's really important. So I'm going to say it again. In and out in 10 minutes.
In my mind, it's the bedrock of the work that we do.
And staff will never turn a person away, whether it's a prescription refill or a psychiatric break.
I think everybody can be helped, but you have to meet them where they are.
The CRC connects to a traditional hospital, a psychiatric facility, and even a court. Now the CRC is going a step further, launching a program called Transitions.
Whatever your crisis is, we can figure it out and help you find a direction, from here.
Peer recovery support specialists like Gary McGinnis will remain in touch with clients for weeks, even months after they leave the CRC, to make sure they've connected with doctors, programs, and other support groups to help them in recovery.
I was homeless.
This no wrong door system didn't exist during his decades of addiction and depression.
My relationship had abandoned me. I suffered from depression. I tried to commit suicide when I was a young boy.
But he's grateful to have a place now where he can use those experiences to help others.
We're the folks who can show others that it can be done, that change is possible.
Change for the person and the community in crisis.